Hi, everyone. Welcome back to Chronic Harmony, where chronic illness meets artistry, honesty, and healing. I'm Diana, and today we welcome Carly onto the platform today to talk about physical therapy. So please, everyone, welcome Carly.
Woo! Yeah,
So, Carly, go ahead and introduce yourself, who you are, what you do, and how we know each other.
yeah. As you said, my name's Carly. I am a physical therapist. I got my bachelor's at Ohio State in health sciences in 2021, and then got my doctorate in physical therapy from the University of Dayton in 2024. So I've been a practicing licensed physical therapist for a year and a half or so about. So with all of my training from school, I work at an orthopedic clinic through a hospital, so that's really nice. Just kind of having access to doctors is pretty quick. We have a beautiful walk path, so sometimes I like walking out there. Um, but more specifically with orthopedics, I felt like I needed to be challenged a little bit more, and so under that scope, I started to also specialize in runners. Um, I run myself. I ran track a lot when I was in grade school and then high school, and then picked it back up to run my first half marathon last year, which was crazy, but I did it.
Look
And
at
then
you.
I know, I was like, one of my friends, she was like, I want to run a half. And my other friend was like, I want to do it too. And I was like, I only have FOMO about physical activity. Sure, I'll do it too. Um, And then another thing that I've really gotten very passionate about is pelvic health. I didn't really have much of a knowledge base going into physical therapy school. And then I knew some of my classmates who wanted to do pelvic health, and I was like, oh, that's great. They're over there. Like, women's health is over there. I'm going to be over here in like potential peds and pediatrics. But then for my capstone project, which was the last semester of physical therapy school, we got to choose kind of our own topic to really delve into. And my topic was on female athletes throughout the lifespan. And so something that I looked at was, how does your pediatric body influence injury? How does pregnancy and postpartum influence injury? Then how does the mature masters influence injury? And from there, from like a pregnancy postpartum, I got to shadow a pelvic health therapist. And I think that really opened my eyes into women's health a little bit more. And then instead of being that naive, like, I just want to do pediatrics in my first semester of PT school, to like, I think I want to do women's health. Like, I think this is something that I'm being called to do. And I really want to investigate that more. And so when I was applying to jobs, I applied to different orthopedic positions, and luckily the position I applied to, I was like, hey, I have a real interest in pelvic floor but also orthopedics. How can you make both work? And the hospital clinic I work at was like, that's amazing, we can set you up with that.
That's incredible.
So yeah, I got certified in just doing an internal exam in November of 2024, and then start seeing pelvic floor patients. And then I think around March of 2025, I took the next course up and did more of a specifics into women's health specifically, which I think was really helpful for just getting a better understanding of all the diagnoses that are out there. Because from an orthopedic standpoint, we have all of these diagnoses that we have to know, but then from a women's health standpoint, there are so many more, like obviously pregnancy, postpartum, prolapse,
Mm-hmm.
incontinence, endo, PCOS, like vaginismus, all the things went on. So I think that
Yeah.
that course really helped me learn more about how to treat all of those different things. But honestly, time that really helps too. And since November of 2025, I've been working on a year-long course on pregnancy and postpartum. It's a corrective exercise specialist course, but I really
Wow.
think that it's helped me in just my broad practice as a physical therapist, just thinking about orthopedic things. But that has been really, really fun to learn a little bit and then actually practice it on the people that I am seeing, and then see the differences that it makes. Um, That's really fun. How we know each other, that's the important. Your husband and my boyfriend were, I knew that they were friends in high school. I don't know about earlier. I know that they went to the same high school and like all of
Right.
that. And then you guys started dating probably like a month or two before we did. But then
Hmm.
it's been really cool to come to all of your shows and be like, hey, that lead role girl, I know her. And yeah, just getting to like connect with people through relationships. I think that that has been really fun. So yeah, that's how we know each other.
Yeah, it's been so fun that you guys are so invested in the shows that I do, and you guys even went to my senior recital for college, and so it was so really, really just awesome just to go up on stage and see the people that you love just there supporting you, and it's so I really appreciate that you guys do that. And then
Yeah.
also you are a doctor, since you have your doctorate, you are a doctor, Carly
Sure.
Archambeau. Yes, yes, yes.
Mhm.
So what was that, getting that doctorate like?
Oh my gosh. I don't know if I would do it again. Jokingly. Like I love my job. I love my job. But yes, so for PT school, I had to take my bachelor. I had to get my bachelor. So that was 4 years. And then after that, to get my doctorate, it's 3 extra years of school. Um, but it was probably the hardest thing that I ever had to do in my entire life to work towards that. I think a lot of it with the stress of PT school because you have all of this information. I mean, the first day of class, we came in and we had a 3 hour lecture with over 150 some slides of anatomy. And I was like, what did I get myself into? Um,
Oh my gosh.
but then, even like the commitment to just learning, like, there were so many weekends that my friends slash classmates and I would be in the cadaver lab studying or practicing skills of how to help people use walkers. Like, it was
Mhm.
not just a 40-hour commitment, it was 80 to 100 a week, plus studying on top of all of that. So, while I say I love my job, the process of getting there was quite stressful, but I had a really, really wonderful class. I mean, we were just all connected and wanting to help each other succeed. And I think that that was the biggest thing more than anything. We're kind of like trauma bonded now. So whenever I see a classmate, I'm like, come here. I miss you so much because, all of that comes back up. Um, but yeah, so I love my job, but also like physical therapy school. Which I think most people will say they're like, that was, yeah, that was probably one of the hardest things I ever had to do.
Yeah.
Um,
Just those like warm memories of
mhm.
so overwhelming and just like, wait, there's only 24 hours in a day, but I need all of those 24 hours to study, but I also need that
Yes, yes,
doubled for in class. Oh my gosh. Yeah.
yes. And I feel like too, also life doesn't just slow down just because you're in grad school. So, for example, like my second semester of PT school, I got in two car accidents within the span of 2 months and totaled my car on the first one. It wasn't my
Mm.
fault, but my car got totaled. And it doesn't stop. I had 1 to 2 exams every single week for 8 to 12 weeks during that period.
Oh
Plus,
my
then
gosh.
also, like, fast forward to when I started dating my boyfriend, like, then you have just kind of like life stressors of starting a new relationship while you're in the middle of school. And it's like, I want to spend time with this person because I am growing to love this person. But at the same time,
Hmm.
like, I have to figure out a way to balance school, which is my first priority right now, and then everything else. And then even family things like being able to still find time to be with my family, even if I was stressed, like I just need just this separation, just a little bit of time to not think about, the stressors of school. But yeah, so.
Yeah, absolutely. I mean, being in the music conservatory, we definitely had a lot of that time of you spend so many hours in the
Mhm.
conservatory studying the music, and then it's like, oh, I haven't seen the sunlight once today.
Yeah.
Uh, but yeah, it's definitely a learning curve for sure. So you talked a little bit about pelvic floor. What
Mhm.
is what is our friendly pelvis? Who is she?
So I love talking about the pelvic floor and the pelvis. I like this picture a lot because it can show the organs. Because when people think of, oh, it's the pelvis, sometimes, yes, you have to start with the bones around it, but then most importantly, the organs. Like, why is the pelvic floor important? What's the function? All of that jazz. So a lot of people think about, the bones of the pelvis, your hips, your sacrum in the back. But I also want to talk about the organs too, because they're kind of the reason
Mm,
why most people come in for pelvic floor is because they have issues with the organs. So you have your bladder right here. A lot of patients that I see will have like leakage issues. For my interstitial cystitis, they have bladder pain, especially with urinating. Then you have your uterus, ovary, fallopian tube, all of that stuff stacked right on top, as well as your vaginal canal too, which can not necessarily like the vagina itself causes issues, but the muscles that we start to see wrapping around all of these structures really starts to play an effect. And then as well as the colon too, with just defecating. Um, but also for me personally, with like pelvic floor stuff, I've had patients who have had anal cancer. So it's being able to kind of
mm,
like navigate that as well. And then I also want to share about the actual pelvis itself. So why do we care? What is the pelvic floor? Most people who come in and see me, they're like, what is this pelvic floor? What's the purpose of it? Why does it matter?
yeah.
Obviously you have your sacrum kind of down and through here. You have your spine kind of wrapping in. I think they put probably L5 right here. You
Mm,
have your lovely hip bones on either side, and then your femurs on either side too, making up those hip joints. But then in terms of pelvis, if we're looking, say, if you're looking from the top down, these are the muscles that you would be seeing. So these are some of the muscles that I have to work with. A lot of these muscles make up your third layer. So this is the deepest layer of your pelvic floor. If you ever had pelvic floor therapy, usually during an internal assessment, a therapist will apply one gloved lubricated finger to each wall and each layer of the pelvic floor, and that's usually the third layer. So it's about 3 knuckles deep in the pelvic floor. So when a lot of people complain of like deep pain and things like that, these are usually the culprit muscles. And then if we scroll down, this would be like if you're looking at it from the bottom up. So we have a lot of nerves that are kind of coming through, and then we also have um, more of those superficial muscles. So when people complain of like, for example, initial penetration pain during sex or during a pelvic exam, these are usually the muscles that are kind of the culprits there. But I like talking about these because you can see how many muscles are involved. A lot of people will talk about the piriformis and like, oh, my sciatic nerve. I'm like,
mm,
yeah,
mm-hmm.
it's getting trapped by your piriformis, which also is right there in your pelvic floor. Um,
Wow.
but yeah, so and then even I think this picture from Herman and Wallace, the course that I took, does a great job of explaining some of the ligaments too that just also surround the pelvis, like your sacrotuberous ligament and then the sacrospinous one, as well as so many others. But yeah, that's the pelvis and the pelvic floor. So that kind of gives you a little bit of a intro of okay, we got organs, we got muscles, we got bones, we got ligaments, and all the things. Yeah.
Yeah, already that's so educational because you hear about it a lot, and it's something that people like to talk about, especially like on social media, and
Mhm.
like the holistic side of the world. But it's like, but what makes up that pelvic floor? So thank you
Mhm.
for clearing that up for, I mean, me, but also everybody who's listening. So the pelvic floor really, I would assume, then affects our daily lives because it's how we walk, it's how we move, it's how we use the restroom,
Mhm.
and even sexual activities.
Mhm.
So how how is it affecting people that you see in their daily lives?
That's a good question. I would say that a lot of it is sometimes for some of my patients who have incontinence and urgency. So, for example, like urgency is the constant need to go to the bathroom. And then you have incontinence where you have that leakage. So it can happen from urine, but then sometimes it can even happen from stool. It can be really debilitating for patients. I've had a lot of patients come in and say, I constantly need to know where the bathroom is. I go someplace new, I need to know where the bathroom is. Or I cut my travel down shorter because I know that I can only make an hour trip before I need to go to the bathroom. I kind of have to plan out my life. And it's like, okay, why are these women planning out their lives based on when they have to pee? Like, that's not
Mm-hmm.
normal. Um, so that definitely is kind of one of the more like functional things. Then it comes to like, for example, lifting, sneezing, coughing, laughing. That is another type of incontinence that I deal with where women can't manage pressure quite well in their abdominals. And so when they go to lift up their kid or lift a weight, sneeze, cough, anything like that. I'm sure you've heard people will squeeze their legs shut as soon as possible to avoid having leakage with a sneeze or a cough. Um,
Mm-hmm.
and I'm like, that's not common. It's common, but it's not normal. So we got to work through that. Um, and then even how we walk. I have patients who come in and as they're walking, I'm assessing how they're moving. Does their one leg swing out to the side as they're walking? How does that stretch and pull on the pelvic floor? Because you saw from the pictures that I was showing you, those muscles are on the inside of the pelvic floor.
Mm-hmm.
They can get pulled and stretched. And sometimes when that happens, it tensions them. So could that potentially be causing some of their symptoms? Um, and then even how we sit. Like, I love the squatty potty. I love it. It's fantastic because humans, to go to the bathroom, we were developed to squat to go to the bathroom. And then
Mm-hmm.
many, many years later, people were like, let's invent toilets and let's invent seats and let's invent jobs that make people have to sit in the seats and then to go to the bathroom have to sit in the exact same position to go to the bathroom. And so something that's really interesting is that our hip muscles don't actually develop the proper way that they're supposed to because we're not going into that deep squat all the time like we are like our ancestors used to. Um, so it's kind of fun working with that functional movement of being like, okay, we know that deep squatting is important. Let's use it as an exercise to help with
Mm-hmm.
relieving pelvic floor tension. So yeah, it affects our day to day. It even affects, like, to make it more consistent with you, singing. So I'm sure
Mm-hmm.
with classically trained, you were taught to hit the high notes. You have to basically feel like you're pushing a baby out, which is very damaging to your pelvic floor, as much as you don't want to hear that. Like, and I'll explain later when we talk more about breathing and things like that. But
The diaphragmatic breathing, yeah.
just even that, like how we breathe. Sometimes people will come in and they'll breathe through their mouths, and I'm like, this is going to get really, really nitty gritty, but we need to breathe through our noses because of the way that there's diaphragms in every single layer. Like there's a glottis, thyroid diaphragm, and then our actual diaphragm, and then our pelvic floor diaphragm. So
Mm-hmm.
yeah, I'm always like, yeah, pelvic floor affects that. Pelvic floor is affected by that all the time. Yeah.
My mind is absolutely blown.
You're like, please do not teach people to push a baby out to hit a high note. I know that you
Yeah,
need to have it here, but like, can we do something? Yeah.
that's that's so fascinating. So, what are some misunderstandings that women have, or even just general civilians have about the pelvic floor?
Gosh, there's so many things. I wish that there wasn't. And this is why it's so important to like educate people because of this. One of the misconceptions that most people have is that leaking is normal. Like,
Mm,
oh, the doctor said that leaking is normal. So, or commercials have made leakage normal, or women make jokes about it. I have a patient who is doing CrossFit and going to the CrossFit gym and working on exercises and things and loading her pelvic floor and muscles. She's like, yeah, a lot of women just kind of like joke about peeing a little bit when they lift the weights. And I'm like, don't tell me that. That just makes my brain hurt. Another misconception is that pelvic pain is normal. Or, like, from your experience, like, period pain is normal. And it's like, yes, but to an extent. So we have to be able to kind of manage that and understand and actually recognize the symptoms and teach women, like, yeah, maybe some pain during like periods is normal, like cramping, but when it's debilitating, for example, for your life history, like that's not normal. And I think also, as you know, you have awakened to it, but also doctors and things should pay attention to that as well and actually listen. Another thing is pain with sex. Like I have a lot of women come in and say, well, you know, I had a baby, like 40 years ago, and I got stitched up, and I told my doctor, hey, I'm having pain with sex. And they're just like, that's just how it is. Just deal with it. And I'm like, not normal. Another thing that's really interesting, and it's, I learned this from a book that I read, Come As You Are by Emily Nagoski. She's a PhD. But that book has just been really, really wonderful. I recommend as many women as I can to read the book just from like a sex education standpoint. She talks about how a lot of women think that if they don't have an orgasm during sex, then something's wrong with them. And that's also not realistic or normal either, because for women, there's about 70% of women, she talks about in the book, who do not have an orgasm during sex, and then 30% do. So then it creates this misconception that, and then I also think culture is influencing it too as well, of all women need to have orgasms during sex. And it's like, maybe some do, but maybe most women need more of a different stimulation, like clitoral stimulation over vaginal penetrative stimulation. So those are just a few of the misconceptions that I feel like a lot of people don't know, and then they think something's wrong with them. So
Good for you for knocking down those barriers. That's awesome. This is the kind of girl talk that I love, of just like getting those barriers knocked down and just being so raw and honest, and just not having any kind of stigma attached to it is really awesome as well. So good for you for being so honest and just ready to educate, and just like plain and simple, these are the facts and this is the way it should be. And
yeah, I mean, I've had I know that I've had some women come in, like I had some women who are older, and we go through pelvic floor therapy, and I teach them, about different pelvic tools like dilators and wands and Kegel weights and things like that. And I had one patient come back to me and was like, I was able to have sex with my husband without pain for the first time in like 30 years.
oh my gosh.
And just hearing that, like, also as a pelvic floor therapist, nothing shocks me, nothing surprises me. I'm like, let's talk about it, because I want to figure out how to fix the situation as best as I can. But yeah, being able to hear kind of like that story of, like, hey, you don't have to have pain. And then being able to have her kind of come back and say, that was really nice, that was really connecting for me and my husband to be able to do that, and not me tense up with the expectation of pain. So yeah, so that's where it's nice to kind of break down those stigmas and those barriers, to be like, actually, you have been either misinformed or not informed well enough. So yeah.
Oh my gosh. And you're out here saving marriages. Like,
I'm trying, if you all need marital counseling, just sometimes see a pelvic floor therapist.
oh, that's incredible. Because I mean, I know so often, you're told like abstinence, 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 and then all of a sudden you get married and you're just like, okay, everything's fine.
Mhm,
Um, and especially as women, it's hard to get past that barrier, and because it is painful, it does hurt for a little bit, and it's just like,
mhm,
but we're not taught or told or educated of like, how do we relax? How do we, you know, learn that this is a time to connect with your spouse, and
mhm,
a time to learn about your own body, because this is the first time that, I'm learning about it. And so it's like an
mhm.
exploratory adventure together. It's like, okay, well, let's go into the caverns and figure it out.
Yeah, right? Yeah. So that's when if I do have patients, like I did have one patient who came in to see me before she got married, and she was like, "Hey, I want to talk about this thing because I'm about to get married, and this is something that has been on my mind." And one of the places that I lead women, if I do have that experience, is I lead them towards using dilators. Um, there is there's different companies out there. I think there are some more affordable companies. Like if you look on Amazon, there are some that are really affordable, especially for us young ladies who are like, how can I afford this plus student loans plus like I'm having a wedding soon, so like how do I manage all of that stuff? And yeah, that's one of the best tools that can kind of like prepare. And I'll have some women be like, but does it like stretch the tissue or like not make you as tight? And I'm like, no, because I know that that can sometimes be a thing where men are like, I hope, I don't want to put myself
Mhm.
in man brains, um, but teaching the tissue how to stretch, that's the importance of a dilator
Mhm.
is to be able to say, okay, I'm getting used to and comfortable with my vaginal canal expanding a certain amount. And so that's the nice thing about dilators too with a progression is that you're slowly building that up over time. So then that way,
Mhm.
when it comes time to be intimate with your partner, it's not, oh, this really, really hurts. Because then that creates this cyclical loop in your head of, okay, every time I'm intimate with my partner,
Mhm.
then I'm going to have pain. So then it's this constant, because I've had many women who will just start to tense up as a response and then it makes it worse. Um,
Mhm.
so yeah.
Because then it becomes a psychological
Mhm.
issue at that point. Yeah,
Yes.
absolutely.
Yeah.
Yeah. Because, I mean, it is a muscle. So, like any muscle, whether you're running or you're dancing, it's just like you've got to stretch, you've got to, work on that. And so, like any muscle, it needs to be stretched.
Yeah.
Yeah.
Mhm.
So, previously you were talking about Kegels.
Mhm.
What are Kegels? What are those exercises, and does everybody need to be doing them?
That's also a great question. I feel like a lot of my older women, especially, were just told like, "Oh, just do your Kegels after you have a baby. It's fine. Just do your Kegels." Um, Kegels are basically pelvic floor contractions. So if you think back to the pictures that I showed you of those muscles, it is the lifting up of those muscles. So I think of it when I teach women how to do a proper Kegel, because some women are like, I'm doing it. And I'm like, no, you're just squeezing your butt muscles together. That's not a Kegel. Um, but when I train people, I give them different things. So it's almost like a hammock is lifting up, or I try to tell patients it's kind of like you have gas or stool and you're trying not to let that slip out. So you're kind of pulling everything up. Or I don't often recommend this, but if someone has difficulty with feeling a Kegel, I say, okay, when you're peeing, you get this one pass because I don't want you to create this cycle of constantly creating tension when you're trying to pee. But try to see if you can stop the flow of urine. If you can stop the flow of urine, that's a Kegel. That's a
Mhm.
pelvic floor contraction. They're both the same. Should everyone do a Kegel? No. It really comes down to what does the actual pelvic floor look like. So a lot of women who have tension, which more often than not, most of the patients who come in and see me have tension in their pelvic floor. So similar to like a tight muscle in your neck. Um, muscles can get tight in the pelvic floor too. So if that's the case, I don't jump automatically to Kegels, because it would be like I tell my patients, and I'll kind of give you this example. It's like if you came in to see me and your bicep was like this. You're like, hey, my bicep is like not working. Can you help me? And I'm like, yeah, let's just do bicep curls. And then you're just curling. And I'm like, well, no, we got to lengthen it first to then be able to actually work through the full movement. So that's where I say, yes, some women can do it where that's what they need is Kegels. Some of it, maybe we have to work through the tension and then work through the Kegels. Some women, especially those who have vaginismus, have so much tension in their pelvic floor that Kegels are going to be so harmful for them, because it's just going to continue on the tension. So I have to teach them a lot of down regulation or down training.
Interesting.
And then, what is down training? It's the opposite of floor contraction. So it's like lengthening the muscles up in the pelvic floor. So if you think about it, it's whenever you go to have, whenever you pee, or then whenever you go to poop, your pelvic floor relaxes a little bit, so it drops. When that happens, that's that pelvic floor relaxation. The muscles are actually expanding a little bit, so that you can do any of those movements that you need to do. So that I teach a lot. And then I also teach the difference between bearing down and straining versus a pelvic floor relaxation versus a contraction, because a lot of women, I'll say, okay, try to, if I'm doing an internal assessment, I'll say, okay, try to push my finger out, and people will really try to like force it out. And I'm like, that's a bear down. That's a lot of straining. That's a lot of tension onto your pelvic floor. It's kind of equivalent or sometimes worse to do a bear down for your pelvic floor health versus if you were holding your breath and then squatting with heavy weights, because it puts so much pressure on your pelvic floor. So that's where it comes in, and I have to teach the differences of bear down, strain versus relax versus Kegel. So that's, not everyone should do a pelvic floor contraction, because it could make matters worse.
Yeah, absolutely. Wow. My mind is blown over here. I'm like, okay, as I'm editing this video, I'm definitely going to be taking notes for my own sake. I'm like, wow, this is golden information. So should women push when they pee?
No. Mm-mm. They should not. I definitely don't recommend it. I know a lot of women will be like, but that's really the only way that I can pee. And I'm like, okay, then we need to work on down training. Or the biggest thing that I care more about is the future or the current. So some of my patients will come in and have a prolapse. Now, a lot of women hear the word prolapse and they want to run for the hills because it sounds so scary. What happens with that is you basically have muscles of the pelvic floor wall becoming weaker. And so then what that causes is one of those organs that I showed you from the pictures before kind of dropping down a little bit into that vaginal canal. I teach my patients, it's not like there's a rip happening and there's a gaping hole and it just slides through. It's just that muscle is not weak enough, is not strong enough to pull it back up. So yeah, I would say definitely try not to strain if you're urinating. If you are straining, then there's something that you kind of need to work on through that. I recommend if women do strain to kind of work on doing a belly breath, because on an inhale, it can really help relax the pelvic floor. So when we get to the topic of why does breathing and pelvic floor stuff matter, I'll go into more in depth of why that matters. But yeah, sometimes I just teach, okay, when you are getting ready to pee, just take a nice inhale down into your belly and then really let those muscles relax. And then that should help with reducing strain. Another thing that I will teach patients for peeing specifically is to lean forward and almost rest your elbows on your thighs, and that can help with just overall bladder position to make it easier to actually get out. Yeah.
Wow. Wow. Very good. So heading into talking about that tension, how does stress affect the pelvic floor?
So much. So I talked about earlier how we can hold a lot of muscle tension in our necks with stress. Same thing in the pelvic floor. If there is a weak link in anything, the body's going to take it and hold on to it. Even
Mm,
if you're working through and trying to relieve stress somewhere, the body's going to try to throw it somewhere else. So, for example, I was massaging my sister's traps one time, and as I was releasing the muscles, she started gripping her hand because her body is so used to creating tension. So,
mm.
the same thing can happen in the pelvic floor with stress is that when people have stress, sometimes their pelvic floor symptoms get worse or the muscles start to tighten as a stress response because sometimes our bodies just need to put energy somewhere, and tightening up muscles is sometimes a way that people compensate with that. Yeah.
Wow. I
Hmm.
feel like I'm having flashbacks of my college experience when I'm doing a lot of singing, I'm doing a lot of inhaling and holding my breath to hold out long notes, and then you don't want to put the stress here because you want to keep this nice and loose. So where do you put it? You can't put it here because it's about presentation, it's
Hmm.
performance, and so oh my gosh, you're blowing my mind today. This is insane. So you've kind of already answered this question already, but can chronic pain or chronic illnesses change how the pelvic floor functions? For example, with POTS, endometriosis, vaginismus, IBS, PCOS, so on and so forth.
Absolutely. It can change how the pelvic floor functions. I mean, if you think about, for you specifically, like with endometriosis, do you know what stage you are at this point? Or have I?
I I think just stage one,
Okay.
but because I was on birth control for consistently for like 8 years, there was just scar tissue left over. There
Hmm.
wasn't any of that buildup.
Hmm.
Um, but the pain is so intense where I feel like if I were to close my eyes, I could map out what my bone marrow looks like because the pain is that deep.
Hmm.
And so with talking about the pelvic floor, I wonder those if it's those muscles that I'm feeling,
Hmm.
or tendons or ligaments or whatever attached to my hip bone that just radiate down my leg.
Hmm.
Um, but yeah, if I'm just a category one, I I can't even imagine what 2, 3, 4
Hmm.
looks and feels like.
Yeah. Yeah. Well, and definitely, so like, for example, from like an endo standpoint, with the development of polyps in different places. So I think with stage 4, it starts to develop around your cervix, and around into your vaginal areas. So right off the bat, you're going to have more pain and more tension and things like that. But then if you also think about going back to stress, where we talked about how stress can trigger or create more tension in the pelvic floor. Now, with endo, obviously having really painful periods, that's a stressful situation. And if you're used to that every single month, you're building up stress to the point where
Mm,
it's like, oh crap, I know my period's going to come and it's going to be death. And I don't want to have to deal with that, but I know that I have to. Um, that can create tension. Plus, just what does the pelvic floor actually do during menstruation? There's a contract and relax of those
mm,
muscles to allow, the uterus contracts and relaxes, which is our cramps. And then we have the opening of the cervix to allow blood to come out. But then we also have those pelvic floor muscles contracting and relaxing too. So then if you have pain and severe pain additional to that, then what does that do? That creates even more tension. And then
mm,
think about it. I'm sure they told you like one of the best positions for cramps is fetal position. Even being in a fetal position can change pelvic floor tension because it can put a lot of downward pressure on the pelvic floor.
mm,
That's if you're sitting up. I mean, if you're laying down, it's not as bad, but just even thinking about how your pelvis is rotating along with your
mm.
spine to just be in a comfortable position, can play a role. For example, like with vaginismus, that is just pain and tightening. Sometimes like a psychological response of like, oh, I don't want to do this. This doesn't feel good. They'll start to tighten up the pelvic floor. Um, and then that can lead to difficulties with pain with sex. Even if, for example, like a patient wants to engage in that with their partner and they're like, I just can't tolerate it. So it's kind of working through alleviating tension from that perspective. And then even like PCOS, for example, having sometimes the pain associated with that around the abdomen. I mean, everything is connected, whether we want it to be or not. The muscles are connected in the core. I do a lot of belly massages to my patients just because of how much soft tissue connection there is, muscle connection, even fascial connection, which I always tell my patients fascia is kind of like the glue of the human body. It takes on a spiderwebby appearance, but it kind of holds things together and it can get restricted just as much as anything else. So, again, if you're having pain, if you're coming down into more hunched positions because of pain, then that's going to influence pelvic floor as well.
So, moving on to more of a pregnancy and postpartum
Mm-hmm.
focus, how can pelvic floor therapy help during pregnancy?
Oh, I love this question. So many people are like, okay, but like, what can you actually do? Even sometimes some OBGYNs don't really know what we do. I teach patients that depending on where you are in your trimesters, it might be a lot. I don't see a lot of first trimester just because their body is still kind of small. And so things aren't really causing a lot of pain. Mostly nausea is usually what a lot of
Mhm.
people are dealing with in their first trimester. But then in their second trimester, people can start to have more round ligament pain. So that's a ligament that will attach from your hip and then hook up into the uterus. So as that baby is growing, it gets pulled. Sometimes people will have like pubic pain right in the front of their pubic bone, um, back pain, all of those things, because with pregnancy, as the baby's growing, your center of gravity shifts. And then because of this course that I'm taking, I'm learning so much more about even how, for posture and positioning, our diaphragm, which is a dome normally, will actually drop and flatten to support the spine because these like our abdominal muscles, are getting expanded as the baby is growing. And then, so working through a lot of soft tissue releases, comfort, transfer training, all of that jazz. And then for the third trimester, I do a lot of labor and delivery prep. Um, so if a woman comes in and yes, they're dealing with pain, I'm managing that, but I'm also teaching them how to re-engage with their core because a lot of women are not doing very many core exercises. And I'm like, okay, so how are you going to push a baby out if you can't find your core?
Mm.
Um, so prepping for that, also just labor and self, like how do I help you find comfortable positions for your pelvic floor and for your body to be able to withstand labor pains because that can be really intense. Um, a lot of women who have epidurals, unfortunately, that causes them to have to then only be stagnant and lay on their back. So then, okay, what does that look like in terms of being able to still kind of stretch if you're not allowed to move? Um, so it's kind of teaching caregivers how to, stretch and move different things just to kind of help with labor progression. But yeah, there's a lot we can do with pregnancy too. And they're very challenging but fun.
Talking about how to engage your abs, don't women their abdominals split most of the time? Is that normal for their abs to split during
In
pregnancy?
100% of
Okay.
pregnant women, yes. You have this basically like this, we call it the linea alba for lack of a better term. It's
Mhm.
that skinny little piece of connective tissue in between all of your abdominals. A lot of people think, oh, it's just between my six pack muscles. And I'm like, well, your six pack muscles are the most outside muscle that you feel in terms of your
Mhm.
core. But for 100% of women who are pregnant, they develop what we call a diastasis recti abdominis, that splitting of that linea alba. And so you get almost like a doming effect. And then that decreases core strength because the core muscles are just not working as well. Um,
Mhm.
but yeah, happens in 100% of them. Sometimes it goes back pretty well. Sometimes I have women who struggle, especially after multiple pregnancies. It kind of stays
Mhm.
open. So we really have to work on, okay, how do I properly engage every single of the four core muscles to make sure that that muscle is coming back together. So then that linea alba comes back to its normal width. Yeah.
Wow. Yeah. So that can really tie into what does postpartum healing actually look like?
It depends on if you have a vaginal delivery or a C-section. So for a vaginal delivery, it depends on what labor and delivery looks like. Did you have any trauma? Did you have to have the baby's head vacuumed out? Did you have to have someone actually manually kind of reach in and pull the baby out? If you were delivering, how long did you have to push for? I have had some women who have had to push for 3 hours. I've had some who only had to push for like 20 minutes. Um, and then also, what does the actual pelvic tissue look like? Because I think a lot of the times with birthing positions, it can create instances of tearing. So that's happening more and more now because in the past, they used to just cut you open before, and then that was it. And then they would stitch you back up. But now we're having women deliver, and then their baby's head is tearing the bottom part of, so between the vaginal canal and the anal canal, there's a perineal area, and there's some tearing going on between that. So for vaginal deliveries, I work a lot on scar tissue. So being able to have that scar tissue improve. And then from a C-section standpoint, I work a lot on the scar itself on that lower abdomen. I teach women how to kind of slowly move it at first, just get comfortable touching it, and then eventually add in cupping. So if anybody's heard of cupping, it's kind of like a pulling up of the tissue with a teeny little cup. It can be really helpful for scar massage and scar releases to that area. And then in general, with most of my women, I'm working on hip strengthening to help decrease pelvic floor tension. Because oftentimes the pelvic floor muscles, I mean, especially for vaginal, they went through a traumatic experience. And then the doctor's like, all right, you're good. You just had a baby. Enjoy life. And I'm like, they just had a trauma. If a man had to do this, the doctor would be like, all right, what do we need to do? How can we fix this? But so for them, yes, hip strengthening, trying to get that back, and then core strengthening, as I was talking about, getting that diastasis to come back. But then a lot of what I've been doing recently is teaching women how to breathe because they breathe so much in their upper chest when the baby is taking up so much room that they forget to know how to breathe down low. So,
Yeah.
mhm.
And so what do you wish moms or new moms knew either before getting pregnant, during pregnancy, and even postpartum?
I think patience with your body is the biggest thing, but then also recognizing when you have pain and seeing a pelvic floor therapist because there are long wait times to see us. So for me, it takes about a month to see me. That's a lot of time, or a month to 6 weeks. And then I think also for women who just deliver, being also very patient and willing to have people help you. As much as you want to help your baby, you also have to have people help you. So from a standpoint of like vaginal deliveries, just taking things nice and slow. You might notice heaviness or pressure, especially in the first couple weeks. That's normal. Those muscles just got really, really stretched out and they're trying to work on coming back together. And then even with a C-section, especially for the women who this is their first C-section, that one's the hardest to recover from because you're basically you're having a surgery. So you have to treat it like one. Don't expect that you can just get up and kind of hop around and walk after having the surgery. It's, touching the scar. It's getting used to doing bed mobility a certain way by rolling all at once, kind of giving yourself some bracing against that scar as you're doing a lot of lifting. Because, with pregnancy, you have that separation of the core, the stretching out of those muscles. But then with a C-section, they're going in and they're cutting through all those muscles to get to the uterus. So now you're having a triple whammy of core issues. So that is probably my most helpful advice that I would give, I think, for that. Yeah.
When should women seek physical therapy then? Should it be something of like, oh, we're talking to our OB-GYN about potentially, getting pregnant, and then should I see a physical therapist now, or should I wait until we get pregnant? Especially since you have that wait time.
So I would say that if you're planning on getting pregnant, that can be a great time to. I know a lot of women, when they get pregnant, they're like, all right, now I'm going to start exercises. No, that's literally probably the worst time to start exercising because your body is going through so many changes and trying to grow another little human. So I would say if you have symptoms, like if you have pelvic pain or if you're having leakage or things like that before you're pregnant, you can definitely get those checked out. If you're having pain with sex, yes, absolutely get that checked out because then we can make that experience a lot easier. So then you can actually enjoy the process rather than it being like, all right, we're just trying to create a baby and it hurts, but we got to do it because we want a kid. So I think working with a pelvic floor therapist to help with relieving tension and making sex more comfortable is important. Now, then with pregnancy, in most states, we have what's called direct access, where you can actually just get an evaluation with a physical therapist and you don't necessarily need an order. So I have had some of my patients who I've been working with. I was working with postpartum and then they got pregnant, or I was working with them for a different orthopedic thing and I was like, hey, by the way, I'm a pelvic floor PT, so if you like need anything, then they can get set up that way. Or if you do notice that you're having maybe the start of some pains and aches, really talk to your your OB/GYN about it, because then it's not just going to magically go away as you progress in your pregnancy. It's going to get probably worse, just because of the baby growing and all of the extra weight gain, lymph, all of the fluid buildup, all of that stuff. So the sooner you can get in, the better, because again, we do have, especially in my city, we have a pretty substantial wait time for pelvic floor PTs. And then for postpartum, it depends on if you have a C-section or a vaginal delivery. So for vaginal deliveries, I have seen women as soon as 1 week after. That's a little bit too aggressive. We can't do anything internal until you've been cleared by your OB/GYN. And so usually we like to wait for about 6 weeks. So if I know that if a patient knows their due date, I usually will say, okay, just go ahead and get scheduled, especially for my pregnancy patients I'm already working with now. Like, if you want to see me after, let's figure out your due date and then just add 6 weeks. It's okay if it's 5 weeks because you went a little bit longer. That's okay because we can still do some breathing and stuff, but let's try to make it 6 weeks. Same thing for sometimes C-sections, depending on how they're doing. It might be more like 8 to 10 weeks after delivery, but we also will see them sometimes 6 weeks after and just kind of work through some gentle stuff until we get to more of that scar healing and can actually address that. Yeah.
So moving on a little bit, how would we improve flexibility and strength? And is that important for the pelvic floor, or can it damage it? So on and so forth.
Yeah. Are you talking just general, like overall body strength, overall body flexibility, or more specifically like pelvic floor?
I think overall.
Yeah. Okay. One, I think it really comes down to what your body needs. I mean, I personally think that everyone needs strength and flexibility, especially in a lot of the things that we have to do day to day, just being able to do those easier. I know that my job is very manual, and some days I'm like, I'm so tired, I don't want to work out. And then I'm like, wait, working out helps me build up the strength to be able to do the things that I need to do to help protect my body. So I definitely think that strength is important. The caveat with that is, okay, just pay attention. Are you having leakage when you are exercising and doing strength exercises? Because if that's the case, maybe you do need to see a pelvic floor PT to kind of talk about how you're managing pressure with lifting. Same thing for flexibility too. I think flexibility is really important, especially because most women have tension in their pelvic floor. Being able to work through flexibility, and then overall in their general body. So that can look like yoga. That's usually a pretty good one that I oftentimes will recommend, or doing regular stretches. There was an interesting research article that came out. It was a systematic review, which basically means it's like the cream of the crop of all research because they look at a whole bunch of different studies, and they were looking at stretching versus foam rolling for the benefits of different things. Something that they found is that foam rolling will help with relieving muscle tension, but you don't lose strength that you've been building, versus sometimes stretching, because of the way that it pulls on the muscle, you can sometimes lose strength with foam stretching.
Interesting. Yeah.
Mm-hmm.
Very
Yeah,
cool.
so I've been teaching a few of my patients how to foam roll. I still teach stretching, so it's not like I'm going to be like, no, stretching is bad. We don't ever want to stretch. But sometimes I feel like, depending on what my patient needs, I'll do more foam rolling rather than stretching, just because I feel like maybe that's what they're missing. So yeah, it really just depends.
Yeah. And so, what role does breathing play?
The most important role in the entire pelvic floor situation, conundrum, and all of that. As I'm learning through all my courses and just kind of working with patients, breathing is probably one of, like I said, the most important role for pelvic floor function. A lot of what I teach my patients, and it's not just breathing in general, like people will be like, yeah, breathing. And I'm like, no, it's breathing down into your belly, but more specifically, actually being able to breathe into your outer ribs and breathing into your back. So I sometimes I teach patients how to breathe, and they're like, yeah, I can really breathe through my belly. So like if I stand up real quick and show you, they're like, yeah, I'm breathing through my belly. I'm really getting that air in. And I'm like, no, that's not how it works. We have to breathe into the sides too. So being able to breathe into the belly, but also into the sides, as well as into the back, are really important. I had a patient who, she was musically trained too, and she was really good at breathing into her belly, but she was not breathing into her ribs. And if we know from, if I give you like a tiny little anatomy lesson, your diaphragm, it doesn't sit down here. It sits up in our rib cage. So my rib cage comes down to about here. It's sitting up in that area. And so if you're only breathing into your belly, you're not getting your diaphragm to actually contract down and relax. And then I also teach patients how breathing is related to pelvic floor function, and how they kind of like yo-yo together. So you have your diaphragm up top, kind of in its relaxed domed state, and then you have your pelvic floor down in your pelvis. When you inhale, the diaphragm will drop and the pelvic floor will also drop. So if you remember from what I talked to you about earlier, so with the flattening of the diaphragm, that allows air to come in, but then this is relaxation of the pelvic floor. So when I was talking about when you go to the bathroom and you're straining, try breathing in to see if that helps relax the pelvic floor. Same thing. So if we exhale, the diaphragm will just softly contract or relax back into its normal state, and the pelvic floor lifts. So that lifting, that's a Kegel. That's what we're doing. So as we're breathing and breathing into our belly, into our lower ribs and back, we're allowing the pelvic floor to move based on a pressure management system. Our bodies have to be able to manage all of this new air coming in. And so, yeah, breathing, it's important for the pelvic floor. But yes, so that's why too, we talked about with singing, if you're singing and you're lowering your diaphragm to breathe and you're counterbalancing it by trying to push out a baby, well, that's really not going to be helpful as you're trying to exhale and push to release that air, you're doing the opposite of the normal
Mm-hmm.
breathing pattern. So, yeah.
Wow. Yeah.
I blow a lot of minds. When patients come in and they're like, "You want me to exercise by breathing?" And I'm like, "Yes, I do." Um, and, and a lot of them come in and they're like, "Wow, this is really, really hard." And I'm like, "Yes, because you have developed a certain breathing pattern
Mhm.
over X amount of years, or when you get really stressed, you start to breathe up." Breathing also plays a role in just overall function. So, to kind of get into like the nervous system, if we breathe up into our upper chest, that is our fight or flight response. So, that's when our body's getting ready to fight a grizzly bear because that's how we were ancestrally made, but that's not how life is now. We're not running into grizzly bears all the time. Um, but in the same response, breathing down into your belly and breathing into your lower ribs, that diaphragmatic breathing, that sets off your parasympathetic nervous system, which that's more of the calm, relax,
Mm.
rest, digest. Everything's nice and easy. We're not getting attacked by a bear. Um, so even from like a pain management thing, I will teach patients how to diaphragmatically breathe. Yes, to help with pelvic floor function and movement, but also to help with pain management too. Um, so yeah.
In my vocal pedagogy class that I took in college, we learn how to breathe. We learn that it's you breathe 360,
Mhm.
and to feel it in your back, in your ribs, in the front, and we learn about those muscles. Um, and then, as for pain management, so many times when I'm having a spike in my endo, I will always tell my husband, I'm just like, I can feel that fight or flight of just breathing so shallowly, and I'm
Mhm.
curled up in a ball, and I just tell him like, tell me to breathe, and he'll like, and just like coach me into that, and
Mhm.
as I'm just like moaning in pain, it helps me calm my nerves, and it's because of that
Mhm.
para. You said the parasympathetic
Mhm.
nervous, yeah,
Yeah,
yeah, and it's all connected.
I know. So connected. And even then, like
For
for example, for you, if you're in different positions just to alleviate pain, he can even give like little cues. So if you're laying on your side and you're curled up in a ball, even if he takes his hand and is like, breathe down into here,
mm-hmm.
just even having that. Or if you're laying on, hunched over a pillow, just trying to be like, you can even just work on breathing into your back too. Um,
Mm.
but yeah, it's nice to be able to have someone who's like, breathe here, because you're like, I can't, you know.
Yes,
Mhm.
exactly. It feels like you're just suffocating sometimes, and I will have him like, I need your hand here on this hip or on my knee or on my back or whatever, and
Mhm.
just that extra little pressure, and even that little bit of a massage kind of helps remind my body where I'm a very visual person, so I like imagining, okay, as I'm breathing in, this is exactly where the oxygen is going.
Mhm.
Whenever I'm stretching and I'm breathing in my stretch, I'm imagining like, okay, my that oxygen is going right to that muscle that I'm stretching.
Mhm.
Um, but yeah, for better or worse, it's all connected.
I know. I'm like, what? Yeah. And something I also do is I'll also do resistance training with patients. So I bought a whole bunch of balloons and I will have them practice blowing up a balloon. And a lot of women will breathe and really focus on pulling their ribs down and in, but then their lower belly starts to pooch out. So if they're kind of here
Mm.
and they breathe to exhale, that can create a lot of pressure down on the pelvic floor. So it's interesting how even doing just normal breathing for pain management or just to get the pelvic floor move, or even like resistance training, how much that kind of correlates with just overall function of the pelvic floor. But yeah.
Yeah. So is kind of gearing back towards stretching and strength
Mhm.
training. Is stretching ever more important than strengthening, or vice versa?
Yes. I would say, again, it depends on how a patient presents. So, for example, if I have a patient come in on their eval and I do an internal assessment, and I'm like, wow, you have a lot of tension. Stretching is going to be my go-to first. Similar to that bicep kind of thing happening. If they're having a lot of tension in the pelvic floor, I need to stretch that muscle out. It's not like I'm going to do one exactly and then once that's perfect, move on. I will start to work on the stretching first and then start to weed in some gentle strengthening to the point where we can kind of focus more on strengthening. For some women, especially like my menopausal women who the shift in hormones has just caused muscle atrophy in the vaginal area in the pelvic floor. I will start to do a lot more with strength training because chances are, because of that weakness, they normally have a prolapse of some sort. So I'm working on strength training the pelvic floor. Similar to with strength, I also will try to work on the outside muscles. So a lot of your butt muscles, your glutes, the muscles that move your hips in and out. So your actual leg in and out. Working on strengthening those up as well, just to be able to like, okay, we're helping stabilize the pelvis so that the pelvic floor doesn't have to work so hard to stabilize.
What are some small daily habits that you recommend everyone start implementing?
That's a good question. Self-love. I feel like that's the most important part because I feel like as women in our culture, there's a lot of things in our culture that actually do influence pelvic floor situations. So, for example, like I have women who maybe they're not confident in what their body is, and so their posture kind of reflects that. And so I have to teach women how to have better posture for pelvic floor function. Same thing too with our culture having some body positivity, but also at the end of the day, also some non-body positivity where to be skinny is like the thing. I'll have to teach a woman how to relax their core because they've been sucking in for so long, especially in my older population. I'm like, you don't have to suck in so hard. It's fine. Let it go. And sometimes it's just as easy as, okay, can you give me 3 days where you just let those muscles go, let your belly hang out a little bit. So I think too, just being comfortable in your own skin, that can even play into pelvic floor function. I also think too, just kind of checking in with your body and saying, okay, how does my body feel? How am I breathing? Am I stressed? How are all of the parts working together? You know, like how is my mental health? How is my physical health? How is my spiritual health? How is my emotional health? Like all of those will influence the pelvic floor too. So there's not like one specific answer where I'm like, do Kegels every day, because I think we need to focus on these things more and have an impact with those and then transition. Specifically for the bladder, something that I also will talk about is, okay, what do your bladder irritants look like? And what are you doing? If you don't have any symptoms, that's okay. Drink your coffee, drink your soda, drink your teas, drink your acidic juices and all of the things. If you're having leakage, okay, pay attention to what you're drinking. Pay attention to what your urgency is. Are you going to the bathroom a lot? Maybe we need to focus on that. Maybe you need to increase your water intake. We should be having half of our body weight in ounces of water every day. And that's just regular people. And that's not even on hot days. And that's not even pregnancy or breastfeeding. Like most women in the day to day need to have whatever their body weight is divided by 2 in ounces of fluids. I'd say trying to make 75% of it, water, but to each their own. But I would say those are probably the most important parts.
For some final thoughts, what do you wish more women understood about their bodies? You kind of touched on that a little bit with the body positivity.
That, and this kind of comes from the Come As You Are book by Emily Nagoski. What does your pelvic floor look like? Like, do you know what it looks like? Have you taken a mirror and looked down there and seen? So then that way you know if things look different or like, oh, hey, I'm starting to notice this weird bump because sometimes we don't feel
Mm,
things. Um, I think that that's important. I also think that female orgasms matter. Just saying it right there, you know? It changes a lot of things. But
that's fantastic.
yeah, I was at this CSM conference for physical therapy, and they had a booth that was like female orgasms matter. And at that point, I was like, what did that say? Can that say that like out in public? And now I think so many women, they come in and they're like, I have so much difficulty with having an orgasm. And I'm like, well,
Mm,
did you know that it's not just like what you're feeling, but actually what you're thinking? Because
mm.
that's how it is. And so, um, being able to have that mind body connection and being comfortable with that, I think is important too. Yeah. Those are the two most important things.
That's fantastic. Something I
Hmm.
really love about our generation is how we're breaking those stigmas and we are having those uncomfortable conversations that shouldn't be uncomfortable.
Hmm. Yeah. I mean, for the most part, most married couples, most regular couples are doing it. So it's like, why are we not talking about it? Or even just, like, how does posture influence things, or how
Mm,
is culture influencing even the way that we're standing or the way that we're dressing or like sucking in or all of those things. And there's so much more factored in than just like, I feel like sometimes a pelvic floor issue is a symptom of a bigger problem.
mm,
If we're not addressing these
absolutely.
big problems, then you're still going to deal with the pelvic floor symptoms.
Because even when you're talking about relaxing to allowing your belly to show a little bit, because there's organs in there, right?
Hmm.
Sometimes we get a little bit more inflamed, especially with endometriosis or PCOS, IBS. Like sometimes some women have more inflammation in places in their body than others.
Hmm.
But even in like when I was in ballet, I remember our teachers saying like, "Oh, suck in those tummies, engage that core. I can see your lunch." And so, and I mean, you're looking in the mirror all the time. You're doing bar, and then you're going into center, and it's about your body posture. It's about how pretty your lines look and if you're flat enough and skinny enough and poised and um, you definitely get used to keeping everything tight and structured so that you look like what a ballerina is supposed to look like.
Hmm.
And then you come home after a long day, or even to this day, I'll just be like, oh, why was I carrying all of that extra
Hmm.
stress when I didn't need to? And I'm allowed to relax. I'm allowed to have intestines and organs in my body. And,
Yeah.
oh, I'm 3 days before I'm supposed to start my period. I'm allowed to be a little inflamed. Um,
Hmm.
so just you talking about that is even for me incredibly eye-opening.
Yeah. Yeah. And I think that's one of the things that I want to incorporate more into my practice, I think, is just teaching women how to let go and just not comparing yourself to others, not having so much of culture influence, especially with social media being such an important part of our society. I actually don't have any social media, and I think that that has been one of the most freeing things in my entire life. Like to not be, I tell my patients because sometimes they're like, "Why don't you have social media?" And I'm like, just think of it this way: we as humans are not built to handle 7 billion people's problems, and with being a physical therapist, I get to deal with because I think it's a privilege to do what I'm doing, but on a given week I'm dealing with 40 to 50 people's problems. My brain cannot handle safely all of the extra fluff that's kind of going on, even with social media. Like, what does that look like? Is that something that is helping you in your day to day? Could it potentially be increasing or creating pelvic floor tension? Because I think that there is maybe a study out there, I'm not sure, but I've definitely heard of people getting like kind of anxious when they go into opening their app and being like, okay, Like, am I going to have enough likes? Am I going to have, what's my feed going to look like today? Are people going to comment on my pictures, or like things? You can start to get tension and anxiety. Some people will actually have anxiety surrounding social media. So it's kind of looking at that and seeing, is that helpful? Is that hurtful? What does that look like for you and your pelvic floor issues going on?
Being a physical therapist and someone who's in women's health, what are those conversations that need to be normalized, either from patient and doctor, or just person to person, mother to daughter sort of conversations, friend to friend?
Mm-hmm. I think one of the biggest ones is pain. So I
Mm-hmm.
listened to this really interesting podcast from the Huberman Lab, and I am blanking on her name, but she was an OBGYN and talked about endo and PCOS for like 3 hours, and it was fantastic listening to her. Um, but what she was talking about was that, especially for clinicians, we need to listen to our patients. You guys know your bodies best. If we discount the pain that you're feeling, then you'll just jump to the next clinician and the next one and the next one. You guys are so persistent at finding someone who will believe you.
Mm-hmm.
And that can just start with the first person. So being able to recognize, okay, is this pain? Is this normal? Is this happening at certain times of the day, certain times of the month? Like, what's going on? Um, to caveat that, I also think that the conversation, especially in young girls around having a menstrual cycle and a period, is so incredibly important. I got to do a talk with another physical therapist on female athletes and talk to high school students and tell them the importance of having a period, because especially for certain, you know, certain competitions or certain sports, losing your period is something that's kind of celebrated, because it's like,
Mm-hmm.
wow, you're working really, really hard
Mm-hmm.
and you're losing your period. That's awesome. And it's like, no, that is not what we want. Our periods are incredibly helpful for hormone regulation, for our bone density, being able to not have osteoporosis, just for
Mm-hmm.
pelvic health in general. I feel like women should not be so shy of talking about their periods. Luckily, I had one patient kind of open up and being like, hey, here's my experience with having a period. And I was like, have you ever heard of period brand X? I don't want to like support one specifically, but did you know that there's period underwear out there? Did you know that there are discs and cups that can sometimes be more comfortable for patients or people over having a tampon, which can sometimes absorb a lot of the blood, but then a lot of the mucosal lining of the vaginal canal, create a lot of irritation, um,
Mm-hmm.
and things like that. And so I feel like pain and periods, I feel like, are two P's that are probably some of the most important things to kind of address when it comes time to just like normalizing those conversations, for sure.
Absolutely. Oh, I feel like if women felt freer to talk about it more, um, we would understand that, what might be common for you isn't necessarily normal. Like what you said, it's so important to talk about your concerns with your doctor, and having that be the first and final stop, instead of having to talk about that concerns with that doctor and another one and another one and another one. And
Mm-hmm.
finally, with the OB-GYN I have now, I went in and I was just like, this is my whole health history book. Here is everything, my first period, my last one, every single symptom I've had. Let's find an answer, and I won't leave until we have an answer.
Mm-hmm.
And it was just finally having that confidence and a little bit of sass to be like, I'm tired of looking for an answer, because I know there's something wrong with me. Can we get down to
Mm-hmm.
what it is? If it was normalized to talk about, even in a high school health class or something,
Mm-hmm.
um, to talk about that pain and periods. And periods are like a monthly report card
Yeah.
of even how the mucus looks in between your periods, can give you a lot of really great information. All of that to say, I 100% agree with you. I wouldn't be doing this if I didn't think that we should be shy about talking about women's health. Um,
Exactly. Yeah. I would caveat that too of kind of talking about like I think in the one podcast I was listening to, the OBGYN was talking about how for endometriosis, most women wait or are finally diagnosed in 9 to 11 years. And it's like, okay, what does that do from a fertility standpoint, even? Like, I know I'm not a fertility doctor or anything like that, but I have patients coming in and being like, oh yeah, it took me kind of a while, or we tried this or that to help with fertility. And it's like, okay, but why are we not listening to patients sooner so that we can actually address these issues so that they're staying out of fertility clinics because things are actually getting addressed rather than just being overlooked.
yes.
Yeah, it's so interesting. Or even just like being able to track, like, okay, what does, my cycle look like? Maybe that's looking at an app. I know that there's different, I don't have one specific app where I'm like, yeah, definitely go to this one versus this one. I do know that, for example, like one of my patients told me that Natural Cycles is an FDA approved app. And because it is FDA approved, you can, for some of my women who don't want to have like a hormonal birth control, I'm like, hey, have you talked to your OBGYN on this Natural Cycles app? Because you can actually get that as a prescription from your OBGYN and then get it
Huh.
reimbursed by insurance. And it is personalized because has like an FDA algorithm. I think you have to wear an Apple Watch or an Oura Ring, or they give you like a band if you have a certain annual plan, and then being able to wear that technology at night. That can be huge for women for birth control without hormones, or even planning a pregnancy because it tracks your spikes in temperature and things like that. So if you want to plan to get pregnant, that can be really helpful. You can follow your pregnancy, you can follow postpartum. I think there's also a perimenopausal kind of assessment. So it's like, okay, now we don't want another app on our phone to have to look at. But if it's for the benefit of having data to then go in and tell your OBGYN, like, look, this is what I'm dealing with month to month. We need to do something about it because I'm noticing something isn't right. Like, I'm always like, advocate for yourself.
Absolutely.
Yeah.
And I think that's awesome. And I think we as a society are kind of getting to a point where we are we're tired of taking medication upon medication upon medication.
Mm-hmm.
We want answers. We want to get down to the root cause,
Mm-hmm.
and find more holistic ways to deal with it, or to help heal from whatever we're experiencing.
Mm-hmm.
And then if there needs to be medications, then go ahead and try that route.
Right.
But I think we're kind of getting to a almost like a drug fatigue, where it's like the last thing I want is for another doctor to tell me, oh, just go on birth control, or just go on
Mm-hmm.
these anxiety meds, or whatever else, to, you know, put me at a baseline when it doesn't get rid of the problem. I want the problem to go away.
Yeah.
I don't want it to be masked.
Yeah, it's just kind of sometimes it's just working with a symptom. And I feel like as a physical therapist, because I cannot prescribe any medications, I think it forces me to be a little bit more creative. And this patient is coming in and is having, X, Y, or Z or pain. How can I provide an alternative method, whether it's stretching, whether it's posture, whether it's strengthening, um, to be able to help them manage that? And sometimes people love to be able to actually learn more about their bodies and say, wait, you mean I can do something for myself and it doesn't have to be just another pill or another, treatment or things like that, which definitely have their place.
Mm-hmm.
But for some women specifically, it can feel very reassuring and almost like, hey, I have independence with this, this thing that I struggled with independently for so long, where I was rejected by so many healthcare providers. Now I have someone who's helping me manage that
Mm-hmm.
independently. So, yeah, it's a lot of fun.
Yeah, it allows the patient to be kind of in control and in the driver's seat of their own body, of their own life.
Hmm.
Yeah. Is there any other advice that you'd like to give women out there before we head off?
Hmm. Great question. I think just some reminders: self love, finding a pelvic floor therapist sooner rather than later. Don't let anything fester. Knowing that a lot of things that we deal with as women are common but not normal because of the continuous misdiagnosis or mishearing or not listening. And being confident if you have a provider who's not listening to you or caring for you, it's okay to go to somebody else who will actually take the time. That person is just a person. Like, you have the choice to go to different people. It's not like, oh, just because this is my person means I have to stay with them. It's like a relationship. You're not going to stay with
Mhm.
someone who is treating you poorly in your day to day. Why would you stay with a provider who maybe is treating you not the way that you feel like you deserve? So
Mm.
yeah, I feel like those are some good thoughts.
That's awesome. Well, this has been a very productive conversation. Thank you so much, Carly.
You're welcome. I anytime you want to bring me back on and talk about exercises, I can do it all day. But I'm glad to
Absolutely.
talk about it, and I feel like hopefully reach more women and just share some of the knowledge that I've gained over this past year and some change of being a pelvic health therapist. So yeah.
I know I definitely learned a lot. So there's definitely going to be a lot of other women out there who eyes are opened and they feel validated
Mhm.
and knowing that there are people who care about them out there. So thank you so much.
Yes, you're welcome.